Cancer is a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells. It can affect almost any part of the body, and its causes are varied, ranging from genetic factors to environmental exposures. Over the years, our understanding of cancer has grown tremendously, leading to better prevention, diagnosis, and treatment strategies. In this video, we will explore the latest research and advancements in cancer treatment, highlighting the hope and progress that science brings to patients and families worldwide. Let's begin our journey by understanding what cancer really is and why it poses such a significant challenge to modern medicine. Cancer develops when normal cells undergo genetic changes that cause them to grow and divide uncontrollably. These changes can be triggered by various factors, including inherited genetic mutations, exposure to carcinogens like tobacco smoke, or even chronic inflammation. As these abnormal cells multiply, they can form tumors and, in some cases, spread to other parts of the body through a process called metastasis. Understanding how cancer starts and progresses is crucial for developing effective treatments and preventive measures. This knowledge forms the foundation for all ongoing cancer research efforts. There are more than 100 different types of cancer, each named after the organ or type of cell where it begins. Some of the most common cancers include breast, lung, prostate, and colorectal cancer. Each type behaves differently and may require unique approaches to treatment. For example, blood cancers like leukemia are treated differently from solid tumors such as those found in the breast or lungs. Recognizing the diversity among cancers is essential for tailoring research and therapies to meet the specific needs of each patient. Several risk factors can increase the likelihood of developing cancer. These include lifestyle choices such as smoking, excessive alcohol consumption, poor diet, and lack of physical activity. Environmental exposures like radiation and certain chemicals also play a role. Additionally, some people inherit genetic mutations that make them more susceptible to certain cancers. By identifying and understanding these risk factors, researchers and healthcare providers can develop strategies to reduce cancer incidence and promote healthier lifestyles. Early detection of cancer greatly improves the chances of successful treatment. Screening tests, such as mammograms for breast cancer and colonoscopies for colorectal cancer, help identify cancers at an early, more treatable stage. Advances in imaging technology and biomarker research are making it possible to detect cancer even before symptoms appear. Early intervention not only saves lives but also reduces the need for aggressive treatments, leading to better outcomes and quality of life for patients. Diagnosing cancer involves a combination of physical exams, imaging tests, laboratory tests, and biopsies. Imaging techniques like CT scans, MRIs, and PET scans allow doctors to visualize tumors inside the body. Laboratory tests, including blood and urine analyses, can detect abnormal substances produced by cancer cells. Biopsies, where a small tissue sample is examined under a microscope, remain the gold standard for confirming a cancer diagnosis. These diagnostic tools are constantly evolving, improving accuracy and enabling earlier detection. Once cancer is diagnosed, doctors determine its stage and grade. Staging describes the extent of cancer spread from localized to distant metastasis. Grading assesses how abnormal the cancer cells look under a microscope, indicating how quickly the tumor is likely to grow. Accurate staging and grading are essential for choosing the most effective treatment plan and predicting patient outcomes. These assessments guide doctors in making informed decisions about surgery, chemotherapy, radiation, and other therapies. Additional cancer treatments include surgery, chemotherapy, and radiation therapy. Surgery aims to remove tumors physically, while chemotherapy uses drugs to kill rapidly dividing cancer cells. Radiation therapy targets cancer cells with high-energy rays, damaging their DNA and preventing further growth. These treatments have saved countless lives, but they can also cause significant side effects. Ongoing research seeks to improve their effectiveness and minimize harm to healthy tissue. Chemotherapy is one of the most widely used cancer treatments. It involves administering drugs that target and kill rapidly dividing cells, a hallmark of cancer. However, because these drugs can also affect healthy cells that divide quickly, such as those in the hair follicles and digestive tract, patients often experience side effects like hair loss and nausea. Researchers are working to develop more targeted chemotherapy drugs that spare healthy tissues and improve patient quality of life. Radiation therapy uses high-energy rays to destroy cancer cells or shrink tumors. It can be delivered externally, using a machine that directs radiation at the tumor, or internally by placing radioactive material inside the body near cancer cells. While effective, radiation can also damage nearby healthy tissues, leading to side effects. Advances in technology are making radiation therapy more precise, reducing harm and improving outcomes for patients. Surgery remains a cornerstone of cancer treatment, especially for tumors that are localized and accessible. Surgeons aim to remove as much of the cancer as possible, sometimes along with nearby lymph nodes. Minimally invasive techniques such as laparoscopic and robotic surgeries are becoming more common, offering faster recovery times and fewer complications. The choice of surgical approach depends on the type, location, and stage of the cancer. Targeted therapy represents a major advancement in cancer treatment. Unlike traditional chemotherapy, targeted therapies are designed to attack specific molecules involved in cancer growth and survival. These drugs can block the signals that tell cancer cells to grow or can deliver toxic substances directly to the tumor. By focusing on cancer-specific targets, these treatments often cause fewer side effects and can be more effective for certain cancers. Immunotherapy harnesses the power of the body's own immune system to fight cancer. This approach includes treatments like checkpoint inhibitors, CAR T-cell therapy, and cancer vaccines. Immunotherapy has shown remarkable success in treating certain cancers, such as melanoma and some types of lung cancer. While not all patients respond, ongoing research is expanding its potential and helping more people benefit from this innovative approach. Hormone therapy is used to treat cancers that are sensitive to hormones, such as breast and prostate cancer. By blocking or lowering the levels of certain hormones in the body, these treatments can slow or stop the growth of hormone-dependent tumors. Hormone therapy can be used alone or in combination with other treatments, and it plays a vital role in managing specific cancer types. Stem cell transplants are used to restore healthy blood-forming cells in patients who have undergone high-dose chemotherapy or radiation. This treatment is especially important for blood cancers like leukemia and lymphoma. By replacing damaged or destroyed bone marrow with healthy stem cells, patients have a better chance of recovery and long-term remission. Advances in transplant techniques are improving survival rates and reducing complications. Personalized medicine tailors cancer treatment to the individual characteristics of each patient and their tumor. By analyzing genetic, molecular, and environmental factors, doctors can select therapies that are most likely to be effective. This approach is revolutionizing cancer care, leading to better outcomes and fewer side effects. As research continues, personalized medicine is expected to play an even greater role in the future of cancer treatment. Clinical trials are essential for advancing cancer research and bringing new treatments to patients. These studies test the safety and effectiveness of new drugs, therapies, and diagnostic tools. Participation in clinical trials gives patients access to cutting-edge treatments and helps researchers gather valuable data. The results of these trials shape the future of cancer care, offering hope for better therapies and improved survival rates. Genetic research is uncovering the underlying causes of many cancers. By studying the DNA of cancer cells, scientists can identify mutations that drive tumor growth and resistance to treatment. This knowledge is leading to the development of targeted therapies and personalized treatment plans. Genetic testing can also help identify individuals at higher risk, enabling earlier intervention and prevention strategies. Biomarkers are measurable indicators found in blood, tissues, or other body fluids that can signal the presence of cancer. They play a crucial role in early detection, diagnosis, and monitoring treatment response. Researchers are constantly discovering new biomarkers that can help personalize therapy and predict outcomes. The use of biomarkers is making cancer care more precise and effective. Artificial intelligence, AI, is transforming cancer research and treatment. AI algorithms can analyze vast amounts of medical data, identify patterns, and assist doctors in making more accurate diagnoses. In imaging, AI helps detect tumors earlier and with greater precision. AI is also being used to predict patient outcomes and recommend personalized treatment plans, making cancer care smarter and more efficient. Liquid biopsies are a groundbreaking diagnostic tool that detects cancer-related genetic material in blood samples. Unlike traditional biopsies, which require tissue removal, liquid biopsies are minimally invasive and can be repeated over time. This technology allows for earlier detection, monitoring of treatment response, and identification of emerging resistance. Liquid biopsies are paving the way for more personalized and less invasive cancer care. Cancer vaccines are designed to stimulate the immune system to recognize and attack cancer cells. Some vaccines prevent cancers caused by viruses, such as the HPV vaccine for cervical cancer. Others are therapeutic, aiming to treat existing cancers by boosting the body's natural defenses. Research in this area is rapidly advancing, offering new hope for both prevention and treatment. Nanotechnology involves using tiny particles to deliver drugs directly to cancer cells, improving treatment effectiveness and reducing side effects. These nanoparticles can be engineered to target specific tumor markers, ensuring that healthy tissues are spared. Nanotechnology is also being used to develop new imaging techniques and diagnostic tools, making it a promising field in cancer research. Palliative care focuses on improving the quality of life for cancer patients by managing symptoms and providing emotional support. It is not limited to end-of-life care, but can be integrated at any stage of cancer treatment. Palliative care teams work closely with patients and families to address pain, fatigue, and other challenges, ensuring comfort and dignity throughout the cancer journey. Survivorship refers to the phase of care that follows the completion of cancer treatment. Survivors may face ongoing physical, emotional, and social challenges, including the risk of recurrence and long-term side effects. Support services, rehabilitation, and regular follow-up care are essential for helping survivors maintain their health and well-being. Research is also focusing on improving the quality of life for cancer survivors. Prevention is a key component of cancer control. Strategies include avoiding tobacco, maintaining a healthy diet, exercising regularly, and protecting skin from excessive sun exposure. Vaccinations such as those against HPV and hepatitis B can prevent certain cancers. Public health campaigns and education play a vital role in raising awareness and encouraging healthy behaviors to reduce cancer risk. Adopting a healthy lifestyle can significantly lower the risk of developing cancer. This includes eating a balanced diet rich in fruits and vegetables, staying physically active, limiting alcohol consumption, and avoiding tobacco. Regular health checkups and screenings are also important for early detection. Small changes in daily habits can have a big impact on long-term health and cancer prevention. Nutrition plays a crucial role in both cancer prevention and treatment. Certain foods, such as fruits, vegetables, and whole grains, contain antioxidants and other compounds that help protect cells from damage. During treatment, maintaining proper nutrition supports the body's ability to heal and cope with side effects. Dietitians work with patients to develop personalized nutrition plans that meet their unique needs. Regular physical activity is associated with a lower risk of several types of cancer. Exercise helps maintain a healthy weight, boosts the immune system, and improves overall well-being. For cancer patients, staying active can reduce fatigue, enhance mood, and speed up recovery. Healthcare providers often recommend tailored exercise programs to support patients throughout their cancer journey. Smoking is the leading cause of preventable cancer worldwide, especially lung cancer. Tobacco smoke contains carcinogens that damage DNA and trigger the development of cancerous cells. Quitting smoking at any age significantly reduces the risk of cancer and improves overall health. Public health initiatives and support programs are crucial in helping people quit and preventing tobacco-related cancers. Excessive alcohol consumption increases the risk of several cancers, including those of the mouth, throat, liver, and breast. Alcohol can damage body tissues and make it easier for carcinogens to enter cells. Limiting alcohol intake or abstaining altogether is an important step in cancer prevention. Awareness campaigns educate the public about the risks associated with alcohol and encourage healthier choices. Environmental exposures such as air pollution, radiation, and certain chemicals can increase cancer risk. Occupational hazards like working with asbestos or pesticides are also linked to higher cancer rates. Efforts to reduce environmental risks include stricter regulations, workplace safety measures, and public education. Protecting the environment is an important part of cancer prevention. Genetic counseling helps individuals understand their risk of inherited cancers. Counselors review family history, discuss genetic testing options, and provide guidance on risk reduction strategies. For those with a strong family history of cancer, genetic counseling can offer peace of mind and inform decisions about screening and preventive measures. Screening tests are designed to detect cancer before symptoms appear, when it is most treatable. Common screening methods include mammograms, pap smears, colonoscopies, and low-dose CT scans for lung cancer. Regular screening saves lives by catching cancer early and allowing for prompt intervention. Healthcare providers recommend screening schedules based on age, risk factors, and family history. Support groups provide emotional and practical assistance to cancer patients and their families. Sharing experiences with others who understand the challenges of cancer can reduce feelings of isolation and anxiety. Support groups offer a safe space to discuss concerns, exchange advice, and build lasting friendships. Many organizations also provide resources for caregivers and survivors. Cancer diagnosis can take a significant toll on mental health. Anxiety, depression, and stress are common among patients and their loved ones. Mental health professionals, including counselors and psychologists, play a vital role in supporting emotional well-being. Integrating mental health care into cancer treatment improves overall outcomes and helps patients cope with the challenges they face. Cancer treatment can be expensive, leading to financial stress for many patients and families. Costs may include medical bills, travel, medications, and lost income. Financial counselors and support programs help patients navigate insurance, access assistance, and manage expenses. Addressing financial challenges is an important part of comprehensive cancer care. Cancer is a global health challenge, affecting millions of people worldwide. The burden is especially high in low and middle-income countries, where access to prevention, diagnosis, and treatment is limited. International organizations are working to improve cancer care through research, education, and resource allocation. Reducing the global cancer burden requires collaboration and commitment from all sectors of society. Pediatric cancers are different from adult cancers in many ways, including their causes, types, and responses to treatment. Childhood cancers are often more responsive to therapy, but they can also have long-term effects on growth and development. Specialized care teams focus on meeting the unique needs of children and their families, supporting them through diagnosis, treatment, and survivorship. Rare cancers, which affect a small percentage of the population, present unique challenges in diagnosis and treatment. Because they are less common, research and resources may be limited. However, advances in genetic research and targeted therapies are offering new hope for patients with rare cancers. Collaboration among researchers, clinicians, and patient advocacy groups is essential for progress. As people age, the risk of developing cancer increases. Treating cancer in older adults requires special consideration of other health conditions, medications, and overall fitness. Geriatric oncology focuses on providing personalized care that balances treatment effectiveness with quality of life. Supportive services and family involvement are key to successful outcomes in this population. Future of cancer research and treatment is filled with promise. Scientists are exploring new frontiers, from gene editing and immunotherapy to artificial intelligence and nanotechnology. Collaboration across disciplines and countries is accelerating progress. As we continue to unravel the mysteries of cancer, the goal remains clear: to find cures, improve treatments, and enhance the lives of patients everywhere. Personal stories from cancer patients and survivors inspire hope and resilience. Each journey is unique, filled with challenges and triumphs. Hearing from those who have faced cancer firsthand reminds us of the importance of compassion, support, and ongoing research. These stories highlight the progress made and the work that still lies ahead in the fight against cancer. Advocacy groups play a vital role in raising awareness, supporting research, and influencing policy. They provide resources for patients and families, promote early detection, and fight for better access to care. Advocacy efforts have led to increased funding, improved treatments, and greater public understanding of cancer. Everyone can contribute to the fight against cancer through advocacy and education. Cancer research and treatment have come a long way, offering new hope to millions of people worldwide. Advances in science, technology, and personalized care are transforming outcomes and improving quality of life. While challenges remain, the collective efforts of researchers, healthcare providers, patients, and advocates are making a difference every day. Together, we move closer to a future where cancer is no longer a life-threatening disease.